I'm Ezekiel Emanuel, the Vice Provost for Global Initiatives and the Chair of the Department of Medical Ethics and Health Policy at the University of Pennsylvania. And for 2 years, from January 2009 to January 2011, I was a Special Advisor for Health Policy at the United States Office of Management and Budget. Well, I think, first of all, getting the Affordable Care Act passed was a unique event. I mean, we've been trying to do comprehensive health care reform in the United States for 100 years. And finally, on March 23rd, 2010, the president signed it. And I think his focus on getting it, the luck, in addition of having a certain arrangement of Senate and congressmen, people who learned the lesson of past failures, was important. But almost everyone will tell you that inside healthcare organizations, it's vital to have a leadership, particularly physician leadership, to encourage and persuade physicians that now is the time to focus in on transforming the system, that they really can transform the system, that if they're willing to take the bull by the horns, they can actually get a better financial deal for themselves and more autonomy in structuring things. It will require that they assume financial risk, but I think that's a good thing. They should be at risk for trying to deliver better care, and I think when they put their minds to it, they probably can deliver amazing innovations. Well, I think I'd say that there are two very important characteristics, or three important characteristics. The first is he really is a great public speaker, and at many times when it looked dire, he was able to give a public speech that got people to refocus on the issue and to push forward. I'm particularly thinking of the speech in early September 2009 after a disastrous August when a lot of representatives went home to their districts and were heckled at town meetings and looked like healthcare was going to go down to defeat, and he was able to bring the debate back. The second is he took very seriously, and I think takes very seriously constantly, his pledges to the American public during his campaign. And if he was going to change off that position, like on the mandate, he had to be persuaded that there was a good policy reason to do that. You know, a lot of people talk about the fact that he hasn't necessarily done much. I think he's had an amazingly accomplished 3 years so far, and I think he has focused on very high priorities and getting them through and getting them enacted. And I think the same thing on healthcare. He never wavered, and despite a lot of pressure to waver, and I think that is pretty impressive.